Hello, everybody. You are in a session, Fund Creation Tiredness. What is the added value of a Global Health Threats Fund? We are very happy to have a distinguished panel here. And before we start the session, we would like to ask our panelists to introduce themselves. My name is Peter Wiesner. I'm a community activist for a couple of years now, and I work for Action Against AIDS Germany. The second moderator is
Marvin Meyer, working with World Vison Germany also for a mere 2 decades, and very happy to be with you all here.
And then we have Robin.
Hi, everyone. Really great to see you. My name's Robin Montgomery, and I'm calling in and beaming into today's terrific session from the unceded territories of the traditional Algonquin and Anishinaabe nations in what's known as Turtle Island, or what we see now as Canada, Ottawa, Canada. And I'm the executive director of the Interagency Coalition on AIDS and Development, and also the board member for the Developed Country NGO delegation to the Global Fund Board and chair of the implementer group of the Global Fund Board. Really nice to be here. Thank you for this.
Nice to have you with us. And we have Christine. Christine, who are you, please?
Yes, very good to be here. My introduction will be a bit short. I'm Christine Stecheling. I'm the executive director of Frontline AIDS, a global partnership that has been around for over 25 years now, of civil society organizations across the globe working on HIV and AIDS. I'm very happy to be here.
Nice to have you with us. And then we have Christoph. Christoph, who are you, please?
Hi, everybody. Very nice to join you for this discussion. Christoph Ben. I'm currently director of Global Health Diplomacy for the Job Lange Institute, a think tank based in Geneva, previously with the Global Fund, so have been involved in the creation of funds before.
So everybody knows Christoph Ben. Nice to have you here with us. And the last person we are going to introduce is Kurt. And Kurt, you are giving a brief introduction to the session, and then we start with the first question. So Kurt, please go ahead.
Thank you, Peter. Great to be with all of you here. And hi, everyone. My name is Kurt Frieder. I'm the president. I was the previous executive director of Fundación Huésped, which is a quite big NGO working in Argentina. I'm based in Argentina, and I'm also, since several years, very much involved with the C20. Have been the coordinator for some years after the G20 was in Argentina. Nice to be with you here. Yeah. And actually, I will start this presentation, if you don't mind, with presenting a few things that have to do with the C20. And the truth is that since 2017, the C20 engagement group gained importance in the G20, demanding more participation in those issues that concern specifically to global health. The recommendations and warnings are similar year after year and concern the rights and well-being of the most vulnerable living in low and middle-income countries. And we at the C20 advocate explicitly for health as a global public good and human right, and are firmly committed to ensuring that women and girls, vulnerable groups, marginalized communities, and key populations as defined by WHO are at the center of global health strategies and responses. I said that in 2017, for the first time, the global health issues was raised by the German presidency, which included global health on the agenda. And the Berlin Health Minister Declaration alluded to global health risks, such as infectious diseases, outbreaks that have a severe impact on the lives and well-being of millions of people, as well as on the global economy. The Hamburg G20 Leaders Declaration mentioned its crucial role in advancing preparedness and responsiveness, safeguarding against health crises and strengthening health systems, and the need of building a resilient global financial system and a strong international financial architecture. The C20 that year final demand was the urgent need for better international cooperation and made a call to the G20 to support a 10% increase in contributions, as well as the reform and strengthening of WHO-based global health needs, but also to make sustainable finance a core focus on the G20 finance track with the participation of civil society. That went on like that, and in Argentina, 2018, the civil society made a call on G20 leaders, reminding them that health is a human right and demanded urgently to take action in tackling global challenges. That the G20 had a crucial role in advancing preparedness and responsiveness against global health challenges, addressing existing and unforeseen health crises, and the importance of strengthening global health capacities with sufficient and sustainable funding. For the first time that year in 2018, the Global Fund was invited besides the IMF and the World Bank to participate in the health ministers meeting. Next year, in 2019, in Japan, we said that fundamental transformation is needed to make the world more equal, democratic, peaceful, and sustainable, and that globally shared problems need globally shared solutions. The first ever joint global G20 Health and Finance Ministers meeting took place on June 2019 in Osaka. Next year, in 2020, in Saudi Arabia, was already driven by the COVID-19 pandemic, and the leaders' declaration stated then that we will continue our effort to reduce inequalities, reaffirming our previous commitments to promote inclusive growth, supporting access to robust and adaptive social protection for all, including those in the informal economy. As civil society last year, we demanded to support the establishment of a collective governance structure to enable transparency and accountability with the participation of representatives of the low and middle income countries and civil society. It was also asked for a strong debt cancellation and increased funding to be used to strengthen public health systems everywhere, prioritizing not leaving anyone behind. And this year, in Italy, 2021, in Italy, the actual central recommendations of our C20 have to do with human rights-based, equity-focused, and gender transformative responses, meaningful and inclusive participation of communities and civil society organizations, equitable access to healthcare, global health solidarity, that it's required a revitalized and reformed global health architecture, and the health and community system strengthening and sustainable financing. We always keep, in our view, the One Health approach that has to do with increasing the capacity for implementation and monitoring through a multidisciplinary approach, considering not only health but also environmental health, agroecology, and food systems, veterinary medicine, etc. And for the first time, we are also talking about the importance of digitalization. I wanted to make this short overview for a start, because I understand that this shows that civil society has been always worried about the same issues and has always been making the similar recommendations to the G20 as the governing council probably among the most important countries in the world. Thank you.
Thanks so much, Kurt, for this introduction to the session. We have now 3 questions that we are sort of discussing with the panelists, and we really want to have a discussion here. So we ask you as participants, if you have a question to raise, just type them into the chat box, and we try to pick them up as good as we can. But I will go over now to Marvin. Marvin, you're responsible to raise the first question. So I'm sure you're talking a little bit about the question and why we raised that one, and then we start a discussion. Thanks, Kurt. Marvin, over to you.
Yes, thank you very much. Yes, this will be a little bit our format. We agreed on just 3 questions, and our panelists will respond and then interact. So without further ado, we thought the easiest would be to start with just the title. And the title was meant to be provocative, and I know Peter took this picture of this really tired angel. It's very close. It's on the cemetery where Bert Brecht, a famous German writer, is buried. And this was kind of our first reaction when we heard of the proposal of the Global Health Threats Fund. A big sigh. And I didn't hear it only from myself, to the people that I talked, not only civil society. But then there was, well, what could be, maybe is there, or maybe there isn't an added value to yet another fund, whereas in the introduction, the panel said we don't want more fragmentation. Now, how that works together, I'm very happy to say this will all be answered by our panelists. No, of course not. We are just going to further comment and think about what was proposed. So I think we are just going to follow, and happily just the same order as we were. Robin, why don't you start us off and then hand over after like 2-3 minutes to Christine, if that's okay. And thank you so much for being very frank with us.
Thanks so much, Marvin. Hi, everybody. So the first question here is around fund creation tiredness and what is the added value of Global Health Treat Fund? So I know that there are many different perspectives on this, and there's certainly no definitive answer. But this is the moment when we, and thankful for today's session, really need to dig in to some of these vital questions that are critical for inclusive discussion and shaping the way forward. There's no doubt that it's a really exciting time in the field of global health. As a civil society member, what is clear to me is that we need a couple of things, and I've just made 4 quick points here. The first one is that we need swift action now. We need the agility and the established mechanisms for the quick deployment of funds. Setting up a completely new structure would obviously result in delayed action and the release of funding when we actually need action now. It's like we're in a situation now where our house is on fire. It's being ravaged by flames, and we're on the sidewalk outside the house debating how best to prevent the fires in the future and what institution should best handle future fires, the fire station down the street or a new superstation. Secondly, when we're talking about moving forward with global health security and pandemic prevention, preparedness, and response, anything that we talk about, we need to be really clear about financing. And the critical piece here is that financing must be based on the principle of additionality. Financing mustn't come at the expense of already really tight ODA budgets. We mustn't crowd out and divert already our existing resources that are stretched in our many different global health issues, largely because of underfunding, but also because whirling from the storm brought by COVID-19. Thirdly, we've got to keep our focus on the unfinished business of today, right? Our leading global infectious diseases of today, like HIV, TB, and malaria, while still keeping our eyes set on the future. Looking only to the future will really set us back years and decades in terms of being able to finish what the global health architecture has set out to under the SDGs. And then finally, we have mechanisms already in place. And there are a number of papers out there, and there are a number of talks that have already started to really massage into these issues. But we have mechanisms that already have well-established systems, strong risk and quality performance frameworks, strong evaluation capacity, adept governance structures, global procurement platforms, and so on and so forth. Most importantly, there are institutions that have multi-stakeholder partnership models that run at the global level, but also at the country level, to really help make sure that action that's taken forward is well coordinated in a way that really promotes the essence of global health solidarity. You know, principles that are really grounded in core values of equity, fairness, human rights, gender equality for all, and as our esteemed host said today, transparency and accountability. But most importantly, it already places populations most at risk and most affected squarely at the center of the response, not only as passive recipients, but as equal partners in the response and in innovative solutions. Thanks, I'll leave it there for now.
Do you want me to go?
Yes, go ahead.
Thanks. And Robin has already said a lot of things that I would have said. I mean, for me, when I hear that question around a new global health threat fund, my first reaction was like, well, we already have one. And that one is called the Global Fund to Fight HIV, TB, and Malaria. And that fund has played a critical role in the last 20 years fighting some of the greatest pandemics that humanity has ever experienced, or at least in its most recent history experience. And also when COVID-19 hit many or all societies really, it was one of the first multilaterals that stepped up and provided resources to deal with this new pandemic. So in a way, I would argue we already have one. We have already a fund that exists, as Robin has already said. And so when I hear people talk about a possible global health threats fund as if none of this exists, then I get worried and I get concerned. Firstly, that a new fund will be set up in a vacuum, as if we didn't learn anything and we didn't know anything about what in the last 20 years. And also, and Robin has already noted this, that this new fund might detract attention, political attention, but also importantly, resources from existing pandemics. And we talk about this new pandemic and this new threat in the future as if we didn't still have pandemics that existed before COVID-19. And so just a few weeks ago, when the Global Fund issued their annual report, it was very clear that we are really in danger for the first time of seeing hard-won gains and progress on these three diseases go into reverse. And that should really be something that should occupy all of us as we're thinking about future threats. So with the G20 coming up and with the World Health Summit and a World Health Assembly on either side of the G20, I think everybody and world leaders in particular need to think seriously about whether starting something new completely from scratch is a really smart way to go. And I liked your picture there, Robin, about fighting fires and still, building something new. So at Frontline AIDS, we would really argue that initiatives aimed at strengthening pandemic preparedness must build on what we already have, and in particular must harness the expertise and experience that already exists, in particular in the HIV movement, because we have something to offer here. In many ways, also the ways that we set up collectively the Global Fund. And we need to keep on talking about those. I think what it means in practice, there might be different perspectives. And I think even in the HIV movement, not everybody agrees on what that would look like and what the starting point should be. So maybe it is not about adding to what we already have, but maybe it is about a new mechanism that is established as sort of a sister fund that works alongside the existing fund. But which is critically coordinated when it comes to replenishment and donor engagement, for example. And both of these approaches have risks and opportunities, but what I think we need to keep in mind is that any future funding mechanism for pandemic preparedness cannot override or leave behind the responses to pandemics that are already right now killing millions of people and are affecting millions of people. I think I leave it at that for now. Should I just choose who to hand over to?
Very good idea.
Hand over to Christoph, like the
you choose.
previous.
That's totally cool.
Good. Christoph.
Thanks, Christine. I'm trying to come straight to the question that we are discussing here. Am I tired of creation of new funds? And I would first of all say, not necessarily. exactly because I've seen also the creation of the Global Fund that my colleagues have already discussed. I can't say generally I'm against the creation of funds, because I've seen how much impact they can have, not just by the amounts of money they raise, but also how catalytic they can be for many processes in countries they support. So it's not a kind of general tiredness, but it all depends on how a new fund is set up and under which principles that we will discuss in a minute. But to the question, what is the added value of such a new fund? I think the added value could potentially be that it might be the way to mobilize tens of billions of dollars that are absolutely required for pandemic preparedness. We all know that, we are lacking huge amounts of money. And over the last 1.5 years, in spite of all the kind of tragedy of the COVID pandemic, still, I think the international community has not been able to come together and mobilize the required funding. So therefore, there could be an added value if such a fund was the vehicle to mobilize these amounts. But then it's still the question, what's the legitimacy of such a new fund? And here I would argue, comparing that to exactly 20 years ago when the Global Fund was created, there was a huge civil society movement from around the world, from all continents, demanding a new fund. There was a UN General Assembly, having a decision point signed up by all member states, asking for a new fund. There was a G8 leaders meeting, asking for a new fund. So there was very, very broad legitimacy. And what I've seen with this new fund so far, I can't see that this has been the kind of bottom-up approach that we've seen with the Global Fund, but rather a top-down approach. A couple of experts saying, yes, we need a lot of new money, therefore let's create a new fund. And I think this will be a point that needs to be discussed. So no, in general, we do need a lot of, more resources. So there could be an opportunity, but then it's very much the question how we establish that. And that's, I think, what we are going to discuss now.
Thank you very much. Kurt, you have another 3 minutes, and then we have to move on, please. And can you unmute yourself, please? Your lips are moving, but we want to listen to you.
Yeah, thank you. Me too. I would like you to hear what I have to say, although my colleagues already mentioned many of the things that I thought. Really, I think that the main problem we are having in this discussion is that we all come from the side of working with the Global Fund on HIV/AIDS and TB and malaria, and that makes us know very well what the Global Fund has done during this 20 or 21 years that it exists, really, no? But the truth is that the G20 mandated the high-level independent panel to propose how finance can be organized systematically and sustainably to reduce the world's vulnerability to future pandemics. And for me, there is a problem of governance and political leadership that is missing. The world was not prepared to deal with COVID-19, which produced an unexpected impact in health issues, with the back and forth and weaknesses shown by WHO concerning the pandemic, and also the economic impact and financial restrictions that the world suffered everywhere due to the closure of local economies and so on. The World Bank and the IMF reacted slowly, and the United States, local politics also caused damage. No, I want to remember. The issue is that a new framework for global public investment was the proposal for that this high-level panel presented, but the truth is that we know that that would mean also to have a new. To have, how can we say that as a new financial tool mechanism would also be part of would have one part that would be dealt by the World Bank and IMF, and the second part would have to be dealt by the direction by the WHO or whoever. And that means, again, a similar structure to the Global Fund. which we understand that has no sense to do at this time. So that's it. Thank you.
Thank you very much. And we have directly a question coming in from our dear colleague Andreas Wolf of Medico International to Christine, which I think is it's nice and provocative, because he asks, Christine, would you advocate for expanding the mandate of the Global Fund beyond the 3 diseases? And would you want it to be stronger involved in health systems building for preparedness? Christine, please keep it to 1 minute if you can.
Yeah, I do think there is scope for it. I think it won't be easy, but I think there's scope for it. For me, you know, a lot of what the Global Fund already does, and I know, as Robin says, many papers have been written about how the Global Fund already contributes to broader public health work, so strengthening health systems and so forth. And I do think there is an opportunity here, because my biggest sense is what we might lose, apart from what Christoph was talking about, the legitimacy, the who's asking for a new fund, is this point around there isn't any other mechanism, as far as I know, that really puts communities and civil society very, very much at the center of what we do. And, you know, sorry if I digress for 1 second, you know, I was based for many, many years in Botswana. I was there when we first got our first Global Fund grant, had our first CCM meeting. It changed how we worked, even in a country like Botswana, on HIV. It meant that the government put us on the table. They asked people living with HIV of what was needed and how it was needed. That was radical. I think now we forget how radical it was then, 20 years ago, but it was. And I think there are so many benefits that we could carry into broader health conversations. And we know people are not one-dimensional. They don't just are in danger of or at risk of acquiring HIV or living with HIV. They have many different health issues that, you know, might be better placed with a broader construct. But will it be complicated? Absolutely. And will it need a lot of negotiation of how that will look? And will there be a fear by many, including myself, that HIV will drop off the agenda if the mandate is extended? Absolutely. And that's our job, to make sure that if we ever got to that point, that doesn't happen.
Thanks so much, Christina, for that response. We are coming now to our second question, and the second question we touched already upon, and it's about the standards. What are the minimal, or what are our standards as community that we would ask for any new created mechanism? And when I say that, I refer to what Christoph just mentioned. You know, this sort of top to bottom approach. We all know, we come from civil society. We know that civil society cannot be created from the top. It has to come from the ground. And of course, I refer, and you referred as well in your what you already said, to the core, some of the core principles of the Global Fund. And I would integrate here UNAIDS as well. You mentioned just CCMs and community-based approaches. We live in times of shrinking spaces for civil society, and I'm really scared as a person that represents communities. I'm really scared of a new mechanism that is based on fears and that is not based on human rights, like the mechanisms that we have at the moment, and that they come from the top. So my very simple question to you: what are the standards that you would ask for? And I beg you to be short and to respond to one another. So be short, precise, and then hopefully we have a conversation. And the audience, if you have questions, please raise them. So we start again with Robin.
Thanks, Peter. I fully agree with what you've just said. It is a really scary time in the world in terms of the shrinking space of civil society. To tag on to what Christine was saying about the role of the Global Fund, I mean, it is also really concerning that we might lose focus, that the targets and the mission-driven investments around HIV, TB, and malaria have become muted under this massive blanket of pandemic preparedness and response. And I think one of the first things that we really need to do, and perhaps this is a call to action for everyone who is here with us today to take home with you and look at different ways in which we can gather to have further discussions, is really figuring out our definitions of what we mean by global health security, right? About pandemic preparedness and response, so that we're clear in what our demands are. Fully agree with what Peter has just said in terms of, in order for us to be able to generate political will and commitment across all stakeholders, we must invert our traditional model of global health and development. We need low and middle income countries at the decision-making table, not just there as a check mark, but with equal voice and equal vote to those in high income, low burden countries, right? We need successful responses that are guided and led by countries and all diverse stakeholders, including and most importantly by civil society and communities, not just as program implementers or as service providers, but genuinely because we are able to connect the dots and see the bigger picture. We are also the ones who are able to conduct really close advocacy around transparency and accountability, ensuring that those governing bodies are able to be accountable to the decisions that they make in terms of investments. And finally, we need those robust investments in communities, in civil society, to ensure that communities who are the most at risk and who are the most affected are the ones who are also able and empowered to take a leadership role in solutions and innovative responses. I'll stop there. Thanks.
Yeah, thanks for that. And Christine, can you add on that? You talked about the communities, yes, but we have to deal with countries that try to design and reshape their communities and don't acknowledge the existence of key populations and reshape them, redesign them. So maybe somebody can add here as well. Christine, over to you, and then there's some questions. But you in the audience, I beg you to respond now to the overall question that we have, and this is about what are the standards. Christine, over to you.
Yeah, I don't have that much to add to what Robin is saying. I think one of the things we should always remind ourselves is it's not about those distant countries that don't acknowledge key populations. Civil society space is shrinking all over the world, including in the country where I'm sitting in the United Kingdom. It's not a secret that the operating environment for what is called charities in this country is also under threat. So civil society space is shrinking, and that is problematic for the future when we think about, was it different 20 years ago when, as Christoph describes it, civil society was demanding for setting up the Global Fund? Are we different? Are we different how we engage? And partly because we have also been collaborators now for a long time. And so some of how we act as civil society has also changed. But so I think one of the standards or the principles, obviously, it's all the things that Robin has said, but I think we need to be careful not to be used as not to create smoke screens by inviting civil society to the table, but not actually giving ourselves or giving civil society decision-making spaces. I'm really shocked in the last 18 months since COVID has happened about how little involvement of civil society was called for in the response to COVID. It was always an afterthought. It very rarely built on what we had learned through the HIV response. So already we get a sense of how far removed we are in the heads of many people who are making decisions. So the principle of participation and inclusion. And I think what I would add there is that we've seen through COVID about how even pandemics that are seemingly affecting all of us equally, we know that those most marginalized in communities, whether that's politically, economically, or socially, get hit harder even. So, and so it is really important to whatever we set up, we are very conscious of the fact that there need to be safeguards for those that might otherwise be very marginalized. And then maybe the last point that Robin made earlier on, I think, is it is really, really important, and Christoph, you spoke about it too. It is important that we're talking about additionality here, that when we talk about new resources, and maybe I'm not as optimistic as Christoph, I do see the opportunity and the chance that this might lead to more resources becoming available. But what I see right now is that a lot of resources are being diverted to the current pandemic that is on everybody's mind. But so the biggest principle needs to be, whatever we do needs to be about additional funding and additional resources.
Thanks so much. Great input. Over to you, Christoph. You are on mute.
We can't hear you for the moment.
So many excellent points already raised. I can assure you, Christine, that my optimism is also moderate, because I do see, of course, the challenge of raising additional resources. But back to the standards and principles, I think just to kind of raise a couple of more points here, in addition to what has already been mentioned, the inclusive governance at the global and the country level, I think, is something that really a new fund, should take on board. And the inclusive governance at the country level, what Christine mentioned with the CCMs and the involvement of community-based organizations, people affected by the diseases, will apply as much to pandemic preparedness as well. But also issues like results-based financing, accountability and transparency is something I think that we've learned over the last 20 years that will be very important for any new fund. And finally, to address pandemic preparedness, there is a great need for much more investment in the health systems. And I would argue particularly the primary healthcare and community healthcare systems. And the same principles that we've learned from disease-specific funding will apply here as well to make that really effective and impactful. But finally, I also wouldn't just argue for kind of, let the Global Fund, take on board all these aspects of the Pandemic Preparedness Fund. But it has to be closely aligned so that all the kind of lessons learned from the Global Fund will not be lost. You can build on some of the same structures, and then you can see how they can together work towards the same goals. But I think the biggest risk that I see is just to reinvent the wheel and not to use, everything that we've learned over the last 2 decades. That would be really a disaster, and obviously would also not lead to the goal of mobilizing additional resources at that scale.
Thanks a lot, Christoph. And Kurt, there's so much said already, so I just wonder what you come up with. If there's anything new that you could bring into the discussion. It's not fair for you. I'm really sorry for that.
It's really not fair.
And I asked my...
The last one in this group of so knowing technicians and people that have been working so many years in the same issue. No? It's not easy really, but when we talk about additional funding, I want to remember, you all know probably, that yesterday Georgieva from the IMF urged the wealthy countries to finally send some COVID aid to poor countries, and talking about the drawing special rights, which 2/3 went to the richest countries. This is something that it has been in the mainstream for already a few weeks, and we don't know what's going to happen, because for this new, it's being talked about the necessity of 75 billion during 5 years. That means 15 billion per year additional funding for this. And we really don't know if that's going to happen, or if it's going to be accepted. And that's the problem, But it certainly has to do also with that clarity is also required to about the mechanism for these investments, in particular, and the source of the needed additional resources. If this 40 of, I don't remember, I have it here written down somewhere, 400 billion are going to be part of the 75 billion that are required or not. It's very confused this time. But when we go back to the issue that we are dealing here, that about the necessity or not of a new mechanism, it's really required to decide, first of all, if the means are available, really, but because we are talking about the global solidarity that is in existence, really. So that's the thing that worries me most, really. Thank you.
Okay, thanks so much, Kurt. I would hand it over now to Marvin. And there are a couple of questions that are raised in a chat box that not 100% relate to what we are discussing at the moment. So, Marvin, I hand it over to you, and you decide if to take one of it on board, and then we continue our discussion. And thanks so much for all of you for the moment. Marvin, over to you.
Yeah, dear participants, please bear with us thanks for all those questions. We won't be able to raise them. And who is the bad guy with censorship? Yeah, it's me again. Well, what can I say? But I really like that question by Kiki Kalkstein, who really thinks she brings us back to the ground. Because now let's talk about the hard bucks, about the dollars. And I really like what Kiki says, hey, what's being done? We are basically, things are already happening. President Biden has already committed funds, and others like EU President von der Leyen at the COVID Summit 2 weeks ago committed to work with the US and within the G20 to establish a global health security financial intermediary fund. And then I think very good question. How can we focus this discussion around civil society engagement in the creation of such maybe a reality, as much as we want to maybe dream of something that is even closely resembling to the Global Fund? And I totally agree and say, can we have our voice heard? But I would like you also to say, well, where could the funds come from? I don't see anybody wanting to do a replenishment for 15 billion every year over the next 5 years. So I guess we can agree on that one. But what could be means and ways of actually doing that? Let me this time allow me to start with Christoph, and then mix it, and then Christine, and then Kurt, and then Robin, because I don't want Kurt to going last all the time. I hope you agree with me. Christoph, over to you. And thanks again, Kiki, for that great question.
Thanks, Marvin. I think the first point is that I have no doubt that the traditional way of resource mobilization will not work. And if anybody tried that, they wouldn't reach the 75 billion, and it would probably distract from other ongoing replenishments of the Global Fund, of CEPI, of Gavi, of other existing organizations. So we need a new approach. And the most promising idea that I've heard over the last 2 years is what Kurt already mentioned, global public investment. The basic idea that for funds like this, for global health threats, pandemic preparedness, we need all countries to pay in. It cannot work anymore that a few rich countries pay for the rest of the world. We've seen how it has failed with Act A and with COVAX. So this principle, every country provides, they can also all benefit according to their need, is for me the only chance, and that needs to be applied particularly for this new fund, and probably can be done more easily because this fund is just being created, so it can be influenced. The governance structure can still be influenced so that all countries feel they are represented, even in a better way than the Global Fund, I would argue, because the Global Fund is missing the upper middle income countries, what they often call the transition countries. So that governance structure is not perfect either. So one can create something better here where all countries feel the responsibility and they see the benefits for themselves, and therefore they feel compelled to pay into this fund. That for me would be the only way how such a new fund, alongside the Global Fund, could succeed in mobilizing the funding we want.
Christine.
Yeah, I agree. I want to just put in one other aspect of the financing conversation. What I'm really missing in this conversation is when we say how much money we need and what the costs are, we are basing on the current system that we're operating on. And that means that continuously allowing the pharmaceutical industry to ask for prices based on monopolies for not only for medicines, but also for technology. We've seen it in HIV, and it's like we haven't learned anything. We have just repeated it again coming to the COVID vaccine. And so I think, not just asking where the money will come from, but what is that money paying for? And why are we talking about such high costs? Yes, there are costs that are there and that we can't change, how much it costs to employ people in the health system and so forth. But there are cost savings that are really, there are solutions to those costs, to those costs that people are just not willing to really engage with. And I think that's another thing we really need to push. And that's a lesson learned from the HIV response that we learned and that wasn't translated into the COVID vaccine response. And I really urge us to not just accept when people say it will cost that amount of money. Why does it cost that amount of money? Because we are not changing the basic setup of how we're running global health and how we are creating costs in global health responses. And I know it's not a popular topic, and I personally thought there was a moment where we could do things differently, especially when the US government stepped forward and called for or supported a TRIPS waiver for the COVID vaccines for the first time. So I do think there is a moment here, an opportunity to also really question the fundamental ways of how we are setting up our global health system and who is the beneficiary really of us creating or not challenging the costs that are created by a private sector that we could challenge really.
Thank you. Kurt?
Yeah, it's a very difficult question, and the response may not be the best one, no? But I think that Christopher said that all countries should contribute to this worth investment required for funding this new mechanism, or even if finally the Global Fund or whatever else is the one that is chosen to continue the work, considering the experience that the 20 last years have been able to produce. But the problem is that I'm the only one from this group that comes from a middle-income country, or that is really a low-income country these days. No, although it's very rich. Marvin knows it very well because he's been with us in Argentina. The problem is that most low and middle-income countries have no chance of being part of raising the funds for this big funding that is required. And the only thing that there has to be a local investment, but it has to be a local investment in the sense that Christine mentioned. There has to be a new way of contributing to the health strengthening system in those countries. That means that somehow we can't ask the low and middle income countries to be part of the big funding, but we can ask them to take over some responsibilities that they have lost in several countries, especially in Africa, due to also to PEPFAR and to the existence of the Global Fund, no, and some local resources can be available, but they won't be enough to cover all what is required. And this is also something that shouldn't be discussed in the G20. It should be discussed in the United Nations more than, because everybody has a responsibility. And although the G20 is supposed to cover the most rich countries in the world, but it's not enough. We have to. This is a bigger discussion than the one that we are having here today. Thank you,
Robin, and then. After that, I would love Christoph for just a minute to respond to the middle income question. I heard you make very interesting remarks a couple of minutes ago, if you wish.
Thanks, Marwin. Really fascinating discussion, and I think, I'm generally in agreement with everything that has been said. One of the key questions that I have moving forward, and perhaps Christoph, you can elaborate a little bit more on how you see this playing out, but all countries being equal come to the table and contribute according to their ability to pay. And in the current context, I just wonder whether or not that is the way that will ensure that we are, moving forward grounded in principles of equity and equality. What we're seeing around the world is shrinking fiscal space. And, that's not only in lower and middle income countries, that's also in high income countries where we're also seeing drops in ODA levels. We're also seeing an increased demand for domestic resource mobilization within these extremely tight fiscal spaces that low and middle income countries are finding themselves in. So would really love to hear a little bit more about how you see this potentially moving forward, recognizing, and as Kurt has said, there are so many countries that wouldn't be able to come and contribute in a meaningful way and would be bound with increased debt loads and all sorts of horrible things like that. So I'll leave it there, but a fascinating conversation that certainly could be a session or a couple of sessions all into itself. Thanks.
Christoph?
Yeah, happy to respond to that. And again, certainly I'm not naive in thinking that, all countries around the world at all income levels have plenty of money that they can now invest in such a new fund. No, that's not the case. But I would argue, yes, they do have resources that they could, invest in such a fund if they wanted to. I want to share with you a quote, actually from the high-level panel that recommended exactly this fund. The G20 High-Level Panel report said, nations must commit to a new base of multilateral funding for global health security based on pre-agreed and equitable contribution shares by advanced and developing countries. So it was this G20 high-level panel itself that kind of made the suggestion of using global public investment principles, even if they don't mention it by name. But I think that has to be the basis. And there are not only countries that, are so squeezed they cannot afford anything. There are a lot of countries that I call the free riders in the international system. There are many high-income countries that don't pay their share for Act A or for any other international initiative or for the Green Climate Fund or what have you. There are many countries that could, if they decided to, pay their fair share. And Act A has developed a fair share, calculation. They're out there. And these are not extraordinary amounts. These are amounts that those countries could contribute. It's a political will. And without that political will, we will never get anywhere near to the kind of resources of 75 billion plus the resources that the ongoing funds will need. So we need to recognize that only an extraordinary effort will protect the world from these future pandemics that we know they will come. And only once they recognize that, they can consider to pay their fair share. And putting everything together, I do think we can come up with very significant amounts that we will need.
May I intervene? Thank you, Christoph. I think you brought a very, very good question to the table. It's really very, very important. I think that in most countries, taxations and tax havens and so on have to be dealt with, but on a global way, no? And we've had these days. It's a new. It's the Pandora Papers appeared, showing how many people have their money in tax havens and so on. And well, that's something that has to be dealt with also, no? And the taxation system and corruption and so on. No, these are all concepts that are very big, and countries are not taking them easily. No, they don't want to take them easily, no? Because not only the lower middle income countries, but also the lower and middle income countries are very much involved in that. Thank you.
Peter, over to you. Yes. I know it's last round. And maybe, I mean, just looking at the chat, there is lots of questions coming. If we have something additional, where should it be located? If not the Global Fund, World Bank, WHO, we know all these questions. That I think would be, I just see the chat questions overflowing with that kind of stuff, if you could refer to that. But Peter, over to you.
Yeah, I think we cannot answer the questions at the moment. We only have 1 hour time, so excuse that. So we cannot start from zero now. I think we need more of those sessions. That's pretty clear. This was and is a brilliant discussions, and I just wrote all the questions down. So I think there's lots of food for thought, and there are many. We can write many proposals for discussions based on your input. My last question, this is just the last round, would be, so if there's a new created instrument, the instrument that we just talked about, would it erase inequality? Be very short. We have only 4 minutes left. So each, I say candidate now, you're not going for election, but each candidate, please, only 1 minute. So, and Frida, it's up to you. You can start now.
Thank you.
Not Frida, Kurt, sorry for that.
No, it's okay. It's okay. I would say that I'm not very optimistic, because the only new thing about this pandemic that we are going through is the virus. Nothing else. Everything else has to do with inequalities and the usual issues that we have been treating since from civil society side almost the last 20 years, not even the last since the C20 exists. So that, unfortunately, I must say I'm not very optimistic. I leave it here.
Thanks. I'm sure, Christoph, you're more optimistic now.
Yes, but I wouldn't be able to say, this can erase, inequality. But I hope it can address inequalities, and that is what we need. Inequalities, by the way, on the global level and, within the countries.
Thanks for that. Christina?
Yeah, I think I'm less optimistic. I think the last 18 months have shown us, and I'm going to sound a bit downer, Debbie Downer here, we would say in England. But, I think, HIV has been around for 40 years. We don't have a vaccine for HIV. Now we're talking about a vaccine to viruses that we haven't even discovered yet. And so it makes me think about whether we call pandemics when people in rich countries are affected, and it is only people in lower and middle income countries we're talking about epidemics. So I feel what we have seen in the last 18 months has really brought out inequality, or maybe has put them in sharper focus rather than ending it. Yeah, on a good day, I would say there are opportunities, but what is needed is real political will and an ability and willingness to learn from the past. And I'm wondering if we really have seen that, but maybe we'll see it in the future.
Thanks, Christina. Robin?
Thanks. So hard to round out after those great interventions, those great thoughts. Maybe I'll look at an optimistic ending here. And although I agree with what's just been said, I also really think that civil society and communities are a force to be reckoned with. And that, we only have to look at history in terms of our ability to really build and push forward health movements. But the main thing is that we have to be loud, and we can't wait to be invited to the table. And I'm not saying that we are, but we need to be really mobilized and really clear about what our wants are and how we're going to strategize to get there. We are there at the Act A mechanism, but barely. And so anything moving forward needs to be better. So I'll leave it at that. Thanks.
Okay, so we are almost at the end. You know that this is a German-led session, so we are at the point finished. But since I had the first word, I would ask Marvin to say the last words. And of course, from my side already, thanks so much to all of you.
It's not going to be a long speech. It's just going to be a long thank you. Thank you all for your contributions, your thoughts, your preparation, your willingness to change schedules and reschedule. It was awesome. And we hope the discussion continues, and we look forward to your input. And Robin, let's all together be loud and continue to be loud. I think that's a very good rounding up. Dear all, thank you for your time. Participants, thank you for your awesome questions. We apologize deeply. We couldn't all address them. And you have a wonderful, wonderful rest of the C20 Summit. Over and out.
Thank you, everyone.
Bye. Thank you.
Thanks, everyone.
Thank you. Thank you.